Hello, this is Margie Meady, and I'm recording the Therapeutic Communication PowerPoint for the Psychiatric Mental Health Nursing course. And a nurse must be aware of either the therapeutic or non-therapeutic value of the communication techniques that she's using or he's using with any client in their care, because they are the tools of psychosocial intervention. So there's a lot of ways that communication can be either therapeutic or non-therapeutic. And also realize that communication isn't just verbal interactions, there are non-therapeutic communication strategies as well. Communication is important for any nursing interaction, not just psychiatric mental health conditions. So it's important to understand what communication is. Interpersonal communication is a transaction between the sender and the receiver, and both persons are participating simultaneously. In this transactional model, both participants perceive what each other is saying, listen to each other, and then simultaneously engage in the process of creating a meaning in a relationship. So it's important that our messages be perceived accurately in how we are intending them, and it is important that we perceive the messages that we are receiving and have an accurate interpretation of what the client is trying to communicate to us. So we bring a lot of pre-existing conditions into our communication. For example, the values, the attitudes and beliefs, the culture or our religious background, our social status, our gender. And this influences both the message that we're intending to send as well as the way the message is interpreted. So values and attitudes and beliefs, an example is that prejudice can be expressed through negative stereotyping. A person who values youth may demonstrate that by the way they dress and behave. That seems to be characteristic of someone of a younger age. Cultural norms, the culture and religion, the moral values of a culture, the norms of a culture, their ideas and customs add to the way they think and their ways of behaving. So, for example, men who hug each other on the street give a different message in the Italian culture than they would in an American culture. Some messages about religion don't even have to be verbalized, of course, or even somebody could cross themselves, which would be an indication of their religion, or they could wear a cross around their neck or have a crucifix on their wall. That is all ways that we send messages to those around us. Social status, example here is that people that are in high status often convey their belief that they are in a higher power position through the gestures that they use, like putting their hands on their hips or standing up to their full height rather than being slumped over, putting more distance between themselves and others that they think of as being in a lower status. Gender has different messages that can be sent as far as masculine and feminine gestures that can influence messages. And that can be related to culture as well. Some other pre-existing conditions that we bring into our communication are the age or developmental level that we are in, or that the receiver or is in. The influence of the developmental level on communication is really strongly evident during adolescence. Sign language is another example of unique gestures that individuals that are deaf or hearing impaired could use. I also gave some, and it's not even just adolescents actually nowadays that are using these different technologies to communicate. So we should be aware of how they communicate, like BFF means best friends forever. BRB, be right back. It's not that we have to communicate the same way, but we do need to be aware of what they're trying to express. Another thing I'd like to point out is that people of the younger ages that are so used to technology have a more difficult time expressing themselves in ways that they're not comfortable. So they might not be able to actually write in the same structure that we expect writers to be at that level in their development. They might not even speak in full sentences and in the ways that, we were brought up and when people are of an older generation. So we do need to take those things into account, and we don't want to, say that somebody is not at the appropriate developmental level when just because we're judging the way that they are communicating. It could be that that they are at an appropriate developmental level for that age. It's just that they haven't had experience communicating in other situations. They're just so involved with their iPhone or their device that they just struggle with having other kinds of communication. They might have a real difficult time with a communication dialogue, and they might be unknowing in their nonverbal communications. In other words, they're stuck looking at their iPhone and they don't even realize that's not an appropriate way to communicate with somebody that's trying to have a conversation. They're not trying. We might perceive that as them being rude or not caring about the interaction, but that might not be what they're trying to express at all. So that's something to think about with age and developmental level. The environment in which the transaction is taking place, you have to think about things like territoriality, density, and distance. There are some of the aspects that are part of the environment that communicate messages. Territoriality is the tendency to own space. Every human being tends to think of certain areas as their space. We all sort of lay claim to certain areas as ours, and we feel safer in those areas. We do know that different cultures have different beliefs on owning space as well, so we should think about that. Density is the number of people within a given environmental space. And prolonged exposure to high density situations usually elicits certain behaviors like aggression, stress, criminal activity, and hostility. So I'm talking about crowds. You know that crowds, the attitude or the feeling of a crowd can actually be contagious. So if a crowd is hostile, that's contagious. If a crowd is a peaceful crowd, that can be contagious. But just simply being in a crowded area can cause emotions to be a little bit more triggered. Distance is the means by which various cultures use space to communicate. So again, how close you stand to another person when you communicate is impacted by how you were brought up and what you felt was an appropriate distance related to intimate distance, personal distance, social distance, or public distance. So intimate distance is the closest that individuals will allow to be between themselves and others. In the United States, it's about 0 to 18 inches. Personal distance is employed during interactions that have a more intimate nature, like a close conversation with a friend. In the United States, this is about 18 to 40 inches. Social distance pertains to conversations with strangers or acquaintances, and so like at a cocktail party or a dinner engagement in the United States, that's about 4 to 12 feet. Public distance refers to speaking in public or yelling out to someone a distance away. In the United States, that distance exceeds about 12 feet. So I've mentioned nonverbal communication as well. You can see in this diagram that I put here that the verbal parts of the communication is a very small part compared to the nonverbal cues that we receive when we're interacting with somebody and the visual. So some components of nonverbal communication include the physical appearance and dress, the ways that an individual would wear their hair, whether they're, we talk about an unkempt appearance as giving the impression that someone isn't caring about their person or caring that they're kind of a sloppy or irresponsible person, and it could be that they're depressed. And so those are things that we take into account and we size up when we're communicating with somebody. Body movement and posture, that's the way that an individual position him or herself as they're communicating their messages, and that gives us signals about how they feel about themselves, their self-esteem, their gender identity, what they think about their social status, whether they have interpersonal warmth or coldness, So some examples could be like a slump posture with the head and eyes are pointed downward, could make us think that somebody has low self-esteem. If people sit with their legs crossed at the thighs, that sometimes depicts a feminine identity. Standing tall with the head high and hands on the hips often indicates a superior status that individual believes they have over the person that they're talking to. Warmth is usually portrayed by a smile or direct eye contact and keeping their hands very still. Touch is another thing that can elicit both negative and positive reactions depending on the cultural interpretation. And some types of touch could be functional touch, where it's a very a very professional touch and it's an impersonal, business-like thing. For example, when nurses are performing certain tasks that they need to touch a patient, they usually are trying to portray some personal intimacy as far as caring goes, but they are still doing it in a professional manner, and they're not doing it where they're crossing any personal boundaries. Another example would be a tailor that was fitting a suit. They're touching that person in an intimate manner, but they're not trying to get personal with them, just like nurses might be giving a bath, but they're not trying to get personal with that individual. They're doing a professional task. Social polite is impersonal, but it's affirming. For example, a handshake. Friendship, that indicates like a warmth and a strong liking for another person. For example, if you put your arm around somebody's shoulder. Love, intimacy conveys emotional attachment or attraction for somebody, and an example would be a really strong mutual embrace or a hug. Sexual arousal is an expression of physical attraction, and so these are just examples. And then we have facial expressions. Next to speaking and using words, facial expression is the primary source of communication, and the face can give us lots of messages such as happiness, sadness, anger, doubt, fear, disgust, surprise. We know that the human face is very capable of expressing feelings that the words might actually contradict. Eye behavior. Eyes have been called the windows of the soul, so social and cultural rules dictate where we can look and when we can look and how long we can look at someone and even at whom we can look. Eye contact conveys a personal interest in the other person, but staring or gazing can make somebody feel pretty uncomfortable. Then there's vocal cues or paralanguage. Paralanguage is the gestural component of the spoken word, and that consists of things like pitch, tone, and loudness of the way people speak, the rate that they speak, how they place the pauses in their conversation, how they emphasize certain words. So how a message is verbalized can be as important as how a message is non-verbalized, I should say, could be as important as what is verbalized. So like I said, if I say, oh, well, that really doesn't bother me, but then I have a big scowl or frown on my face, I think the message of my frown would overrule what my words said. And this is a list of some therapeutic communication techniques. I'm not going to sit here and read these to you, but I will tell you that it's important for you to know these techniques and be able to pick them out if you saw them described, or understand when they might be appropriate to use. One of the things that we don't use often enough is silence. We, as in the United States, are pretty uncomfortable with there being pauses or silence in our conversation, and we seem to think we have to fill up empty times in a dialogue with saying something else. And another issue is that it might be a cultural idea that it's not a good thing to have every moment of every conversation be filled with words. It might be that they're trying to convey respect by waiting and considering what you're saying, or they're maybe trying to understand what you're saying and make sure that they're giving a thoughtful response. I think that trying to be comfortable with silence is a skill that needs to be practiced. So I would suggest that you do know what these techniques are and be able to give some examples of these different techniques, or recognize them if they were to be presented to you in a scenario, and realize that they are therapeutic in nature and that they can enhance the conversation. Another one I want to point out is the giving broad openings, allowing the client to select the topic. We often think we know what the issue is, and we steer the conversation to the problem or issue that we want to talk about, and that might not be anything that the patient is concerned about. An example that I like to give when we talk about doing history taking or assessments is when you go in and you go through the questions of an intake with a patient, asking them about their medical history or their family or those sorts of things, or what they're there to be seen for. You can get through all of those questions and think that you're asking every specific question about every detail in their life. And then you can ask them all of the things you need to ask them about the complaint or the issue that they're there for, using the old card or whatever tool or format you're using. When did it start? How long did it last? How long has it been going on? How long is it lasting? Old card characteristics, everything. You get through all of that, you think you have every detail that you could possibly ask or need to know about this person, and you've communicated as therapeutically and effectively as you think is humanly possible. And then you get to the door and you get ready to leave, and you put your hand on the door and they say, by the way, or I wonder if, or I was thinking, if they ever do that, if a client ever does that, I always call it the by the way complaint or the doorknob issue. Stop, go back and sit down again, and then let that broad opening, is there something else you'd like to discuss? Or I sense that you would like to talk about something else, and let them tell you their story, because they probably needed to warm up to you. They probably needed to figure out if they trusted you. They might have been hesitant or nervous about explaining it. And now that you're getting ready to leave, they're thinking, oh my gosh, I'm going to lose my chance to tell her or him what I'm really worried about. And I better blurt it out now or I'm going to miss my opportunity. So broad openings, or don't ask the yes or no questions. Ask, can you describe that? Tell me how you feel about that. So offering those general leads encourages the client to continue. Asking about the time and sequence of events clarifies how these situations occurred. Making observation is just verbalizing what you're observing or perceiving. You could say something like, I see that you're tapping your foot, or is this conversation making you anxious? Encouraging them to describe how they're feeling or perceiving what's going on. Tell me how you feel about that. Encouraging comparison, asking them to compare similarities and differences in their ideas or experiences. Or did that make you more sad than when you had a similar situation in your life before, or things like that. So be aware of these communication techniques and be able to recognize them and understand how to use them effectively. You're going to use them for your whole professional career. And here's the second set of therapeutic communication techniques. Restating is something that nurses use very frequently, just to make sure that they're communicating, that they're listening, and that they understand what the client is saying. I hear you saying this, or just reflecting back the question or the feeling so that the client can be recognized and accepting. You say that you feel nervous to be out in crowds. Reflecting redirects the questions back to what they're saying. Focusing is taking notice of a single idea or a single word. For example, you seem to be saying the word sad in a lot of the ideas that you're telling me. Exploring is delving further into the subject, asking them to give you more details. And so you can go through the rest of these communication techniques, and you can see all the examples. They're in your book, and there's a table in your book that gives you really specific examples. And again, make sure that you could identify them if you saw them described in a test question, or that you could give an example. And then we have these lists of non-therapeutic communication techniques, like giving reassurance. Oh, don't worry, it'll be fine. That makes them feel belittled. Rejecting, all of these different examples that are here. Again, I will let you go through these and make sure you can give examples. Here are some other non-therapeutic communication techniques. So again, just realize that you're going to be practicing these all the time. Try one or two, not the non-therapeutic ones, try the therapeutic ones with your friends and family. And if you feel like a communication with somebody in your family or your friends didn't go quite right, go back to these lists and try to figure out what might have happened. Try to use different times you're talking to people in everyday, like at the grocery store or with your classmates or anybody. Try to kind of analyze what happened back and forth, what went right about that conversation, or if something didn't feel good about the conversation. Try to go back and reevaluate it and see if you can identify either something that you did that was a therapeutic technique or something that you did that was a non-therapeutic technique. And that will help you get a handle on these. I call them facilitators and blockers. At this point, I created a whole separate therapeutic communication PowerPoint that I might go ahead and share with you as an optional resource. And it might be something that you can use in your lab sections, weekly lab sections as well. And this slide goes over how important it is to make sure that you're trying to portray that you are actively listening, meaning to listen attentively to what's being said, listen to both their verbal and nonverbal messages, and be totally present in the moment. Don't be taking notes. Don't be looking out the window. Make sure that the environment is designed so that you can be attentive and actively listening. You shouldn't have the phone the phone shouldn't be able to ring, and there shouldn't be other distractors in the environment that would take your attention away from that client. Use this an acronym here for making sure that you're doing what you need to do to portray that you're actively listening. Sitting squarely to face the client, using an open posture, leaning forward toward the client, establishing eye contact, and having a relaxed demeanor. Process recordings are writing down the verbal interactions that you have with clients, and they can also include the nonverbal interactions. They're written usually by nurses or students to try to improve their communication techniques. I know that we used to require this as one of the assignments in the associate's program. We called it an interpersonal process recording evaluation. So we called it an IPRE, interpersonal process recording evaluation. So the student would write down everything that they said and everything that the client said, and then they would, beside the words, they would try to identify if it was a therapeutic technique or a non-therapeutic technique. And they would also evaluate their non-verbal communication as well. Like they would say, sitting with my hands in my lap, or sitting with my legs crossed, or patient is sitting with their arms crossed. So they would try to evaluate what the patient was doing that could be enhancing or facilitating the conversation, or what they were doing to block or non-therapeutic techniques that were being utilized for both themselves as well as the client. And then it helped them identify these therapeutic techniques as well as non-therapeutic techniques. That helped them identify them, and it helped them figure out how they could have said something different. And as I said, often students realized that they should have just simply remained silent for a little bit longer, and that therapeutic technique would have been the answer to the struggle that they had with that conversation. So this slide talks about feedback. Feedback is useful if it's descriptive rather than trying to evaluate what happened. If it's simply just, I notice that you're clenching your fists, rather than evaluate, I see that you're clenching your fists, you must be mad. And if it also focuses on the behavior rather than on the client. So if you say it seems like something is distressing you, rather than it seems like you are mad or you are distressed. And if it's specific rather than general. So being mad or distressed is very general, rather than saying it seems like this situation has caused you to have some feelings that you're struggling with. So again, not saying you're a mad person, you're an angry person, trying to be specific about what's causing what you're evaluating or what you're giving feedback for. And again, directing it toward the behavior that the client has a capacity to modify, not labeling them as an angry person, but labeling that emotion as being connected to something that occurred, some part of what they're giving the feedback for. So, and you're trying to use feedback to give information rather than offering advice. And it needs to be well timed as well. You're not going to say, wow, you're awfully angry when they're in the middle of trying to explain something that occurred that did cause them to be angry. You're going to let them go ahead and express their feelings and then maybe offer some feedback. And again, it has to be feedback, not advice. So here's some example questions. The nurse is performing an initial assessment on a newly admitted client who is oriented ×4. Which of the following communication techniques would best facilitate obtaining accurate and complete client data? I'll give you a second to review the answers. Go ahead and put it on pause, and then I'll say the answer. The answer is C. Open-ended questions are phrased in a way that gathers as much information as possible. By the use of phrases such as tell me about it or describe to me, that gives a lot of rich information can be assessed. Closed-ended questions would block things off, and asking people to explain or interpreting are also not going to facilitate the conversation. As the move-out date to leave the shelter gets closer, a battered wife states, I'm afraid to leave here. I'm afraid for my safety and the safety of my children. Which nursing statement is most supportive? Go ahead and put it on pause, and then I will tell you the answer. Correct answer is A. The nurse is using therapeutic techniques of reflection and formulating a plan of action by saying, this is a difficult transition. Let's formulate a plan to keep you all safe in the community. The use of these communication facilitators indicates that the nurse is supportive of the client's feelings and appreciates the need for a safety plan. The manager needs to meet with a client who is exhibiting escalating hostility. Which would be the most appropriate location for the nurse to meet with this client? And the correct answer is B, a quiet corner of the day room. Not in the room with the door shut, not at the nurse's station where there's a lot of chaos and extra people around that could cause agitation, and not in a treatment room where there would be things that could be unsafe if somebody were to get more hostile. So I hope you enjoyed this presentation and found it beneficial, and thank you very much for your time and attention.